Natasha, and today I'll be discussing the Australian National Chronic Disease Strategy in relation to depression and Rob, an individual living with depression. The Australian National Chronic Disease Strategy, or NCDS, was created to address the rapidly increasing burden of chronic conditions in Australia. It aims to create a national direction for the prevention, treatment and care of individuals living with one or more chronic diseases. It outlines 4 action areas surrounding prevention, early detection and treatment, integration and continuity, and self-management to guide healthcare services towards implementing changes to reduce the burden of chronic conditions on the healthcare system and increase the quality of life for those living with chronic conditions. When caring for individuals with chronic conditions, it is imperative that the healthcare professionals consider the NCDS, as this document will help guide their practice to maximise patient outcomes and minimise the burden on the healthcare system. The NCDS outlines a clear framework for healthcare professionals to reduce the impact of chronic disease to achieve maximum benefit for consumers. The individual studied for this presentation is Rob, a 47-year-old man who was diagnosed with major depressive disorder in his 20s during a major depressive episode. The World Health Organization defines depression as a mental disorder characterized by prolonged periods of sadness, diminished interest, feelings of guilt and low self-worth, and poor concentration. Rob has had multiple depressive episodes ranging from moderate to severe, some of which have resulted in hospitalization and forced treatment. The action area chosen for this presentation is early detection and early treatment. The NCDS outlines that many chronic diseases could be detected earlier. However, because many people are unaware of the risks for chronic disease and the early signs of these diseases, they do not present to the health services that provide opportunities for early detection. The NCDS outlines that while there are already approaches to increase early detection, including opportunistic screening for risk factors and disease markers, and population-based screening, there is a need to increase the use of these across the board, particularly in the primary health sector such as GPs. While Rob didn't present to the doctor specifically because he was feeling down, in the early stages of his first episode, he had contact with healthcare providers who failed to screen him for depression, despite him being at risk due to being recently divorced and lacking a supportive network. The depressive episode became very severe and resulted in hospitalization, and when medication failed to help, forced electroconvulsive therapy treatment. Early screening for depression would likely have resulted in earlier treatment for Rob, which may have prevented the episode developing into a crisis. My recommendations for practice in relation to early detection and early treatment are for primary healthcare providers to take more opportunities to screen and test consumers for a variety of chronic diseases and disorders. Early psychological treatment, such as talk therapy, could have been very helpful in the course of Rob's disorder and may have prevented the necessity of forced pharmacological and ECT therapy, lessening the negative effects on Rob and lightening the burden on the healthcare system. Thanks for watching.